This lecture is about obsessive-compulsive and related disorders. By the end of this lecture, you should be able to answer the questions of what is an obsession and what is a compulsion. You should also be able to address the characteristics of obsessive-compulsive disorder, also known as OCD. And you should also be able to answer the question of who is at risk for developing OCD. In terms of a category of obsessive-compulsive and related disorders, the DSM lists quite a few of these different types of disorders. This category of disorders includes the following disorders: obsessive-compulsive disorder, body dysmorphic disorder, hoarding disorder, trichotillomania, which is hair-pulling disorder, excoriation, which is a skin-picking disorder. We'll be focusing in this lecture primarily on obsessive-compulsive disorder. Obsessions are characterized by recurrent and persistent thoughts or urges that are experienced as intrusive and unwanted, whereas compulsions are repetitive behaviors or mental acts that an individual feels compelled to perform, often in response to an obsession or according to self-imposed rules. A person with obsessive-compulsive disorder feels compelled to think certain thoughts or perform certain actions, even if those thoughts or actions make no sense, and even if they know that they make no sense. Approximately 20% will only have obsessions or only have compulsions. The remainder of individuals with obsessive-compulsive disorder will experience both obsessions and compulsions. It's important to note that the obsessions-compulsions are very extreme in obsessive-compulsive disorder. Everyone has minor obsessions and compulsions. For example, I often leave my house and then go back after a few minutes to check that I locked the door. That's a reasonable compulsion that many people experience. But the obsessions and compulsions in obsessive-compulsive disorder are particularly extreme and often involve repetitive actions. For a diagnosis of obsessive-compulsive disorder, the obsessions and compulsions must be present in the absence of other identifiable disorders. It's also important to note that infatuation with another individual is not obsessive-compulsive disorder, and perfectionism is usually not considered to be obsessive-compulsive disorder. So what are obsessions? Well, obsessions are recurrent, persistent thoughts, impulses, or images. These feel both intrusive and inappropriate and cause distress to the individual. Those thoughts or impulses or images are not simply excessive worries about real-life problems. Often attempts are made to ignore or suppress the thoughts, impulses, or images, or neutralize them with other thoughts or actions. This leads to what's known as the thought avoidance paradox. That is, if someone tells you to not think of pink elephants, of course you start to think about pink elephants. Individuals with obsessive-compulsive disorder usually recognize that the obsessional thoughts, impulses, or images are a product of their own mind. Compulsions, by contrast, are repetitive behaviors, such as hand-washing or checking various things, or mental acts, such as praying or counting, that they feel compelled to perform in response to an obsession or according to rules they have made for themselves. Those behaviors or thoughts are focused on preventing or reducing distress or preventing some dreaded outcome. However, they are not realistically connected to what they are designed to reduce or prevent. So who gets sick with obsessive-compulsive disorder? Well, there's actually little gender difference in obsessive-compulsive disorder, and about 2.5% of the population will experience a diagnosis of obsessive-compulsive disorder at some point in their life. Onset is usually in the late teens to early 20s, slightly younger onset in males. The prognosis for recovery, given some treatment, is actually quite good.